All right, everyone, we're lucky enough to have with us right now Cameron Webb with the Equity COVID-19 response team with the White House. Give us sort of an overall where we are right now and how much further we have to go before we're getting to some goals that we've set here in the past.
Well, of course, the goal at this point is to end the pandemic. That's the overarching goal that the president's articulated. We're doing everything we can to that end. We're seeing that yes, we've had a surge in cases because of this Delta variant, because of how fast it spreads and how transmissible it is. But we've also seen a surge in the number of Americans getting vaccinated really over the last couple of months. And so that's been a big deal. I think seeing more and more people get vaccinated. It's gotten us to the point where now we're down to about 70 million folks left who we need to get vaccinated to really make sure everybody's protected. And so, again, good progress, but still a little ways to go.
What's going to be the best strategy you think moving forward? We've seen a lot of different ideas. First, just information. The president came out pretty hard with maybe kind of like the tough love approach recently. What else is left to kind of be as creative as possible to get some folks thinking along those lines?
Yeah, every tool in the tool belt at this point. Certainly getting information out there, meeting people where they are. Certainly incentives have been a big part of this really over the last 6 months or so. And more recently, the vaccine requirements, whether it's employers or even for some large sporting venues, we're seeing the impacts that's having. People want to get things back to normal in terms of the way that they navigate their communities, their workplaces, and their lives. And we think vaccination is really our best tool to get there because of how effective it is at preventing hospitalizations, preventing deaths, the worst outcomes that we see with COVID. And so I think it's a big deal. But I think that all those strategies have their place. It depends on who you're talking to and where, but really have to make sure that we're meeting the moment, we're using all those tools, and we're getting more people covered each day.
You work with the Equity COVID-19 response team. What progress are we seeing with communities of color in particular?
Well, we've seen a lot of progress, so the White House COVID-19 response team, all of us have different roles. And my particular focus, I'm the senior policy advisor for equity. So looking at rural communities, making sure that as we see upticks in cases or hospitalizations, that those aren't, disproportionately happening in rural communities and where they are, making sure that we're rallying resources to address those. Certainly, we talk about communities of color, the vaccination rate in the Black community was lower. We've seen those gaps really start to close over the last couple of months, which is really, really good to see. Since about July, we've seen those gaps close significantly. And in the Latino community, we've seen those vaccination rates have actually exceeded the vaccination rates among white Americans. So we're seeing that there's a lot of progress on that front. But again, all things equity are always hyper-local. You can look at national statistics, but it comes down to what's happening in your community. And if you have the resources, the support, and the information necessary to close gaps locally. So we're getting hyper-local, getting into communities, working closely with community members and leaders, and that's how we're getting it done.
Glad to hear about some progress. We'd like to hear about that. But when we look to the future, we say back to normal. What is back to normal in this point anymore? Because wearing masks isn't normal, yet it seems to be there's a lot of rules with that still. Getting another shot or maybe one every year doesn't feel normal. Is that the kind of normal we're going to be going towards, or are we looking at maybe where we don't have to deal with even saying this anymore?
Well, I'm an internal medicine doctor. I've been practicing medicine for a while now. I know it's really tough to predict the future when it comes to medicine, but I do know that when we talk about what's normal, COVID-19 isn't going to just disappear. I know that's was a hope that some people had early on, but that's not practical. It's not going to happen. The key here is making sure that it's reduced to just a normal upper respiratory infection, and we're able to protect everybody who's the most vulnerable. The key is making sure that we're getting that widespread immunity against COVID-19, and I think those are all things that to this point look like they're achievable if we just use all the tools that are available to us. And so normal in the future is going to look like taking some precautions. It's going to look like making sure people have immunologic protection. It's going to look like making sure we have the resources in community and in hospitals to withstand any increase in cases. But at the end of the day, I think America's never going to go back to where we were. It's going to be a new version of how we navigate healthcare crises, infectious disease, pandemics. It's a brave new world for us, and I think we're building the infrastructure for that to be even better.
I hope you have a few more minutes here. We're just going to get to some more topics that I hear a lot about. When it comes to the kids, it looks like we're getting close to getting approval for the vaccinations for that age group, which hasn't happened yet. But also, I looked up some numbers the other day. The chances of a kid going to the hospital is something like 5 in a million. Can we talk about how safe this has been for them overall, and yet it can be even safer once the vaccinations become possible for them? Seeing both of those things as truths.
Yeah, I try not to get ahead of the data. So I know that we're getting pretty close with Pfizer, at least planning to submit their data to FDA for full review pretty soon for ages 5 to 11. I have a 6-year-old and a 10-year-old, so I'm particularly interested in this particular area. But what I'll say is that, you know, whenever people cite how infrequently kids become really sick with COVID, I just give them the reminder, those statistics don't matter to you if it's your kid, right? And if this is something that we can prevent, this is something we can protect kids even more with vaccination, much like the others that they get heading into school that's been proven to be safe, and hopefully that has full FDA approval just the same, then that's something that I, you know, as a parent, I would give to my child to keep them safe, to avoid being one of those rare instances of a horrible outcome. And so I think that's what's important to keep in mind. A lot of what we're doing is we're mitigating risk. We're trying to avoid anybody's family dealing with the loss of one of our precious children when it could have been prevented. That's really what this is about. Now, in terms of the safety, that's why we have to let that FDA process play out. You know, we know it's a different dose than for adults, it's about
Right.
1/3 the dose. And so we want to make sure that as that process plays out, we're not rushing it. We're just making sure they have the resources necessary to be really thorough and to make sure that they're uncovering all the rocks to make sure it's safe for our kids.
Yeah, the most information we can have out there for the parents, then you can make the best decision for your family. And I'm sure you're making some of those decisions just like I am. I got some young kids as well. So, hey, thank you so much for your time. Cameron Webb with the Equity COVID-19 Response Team. We really appreciate your time and all the information.
Thanks for having me. Take
Yep.
care.